everyone, it's Professor Williamson. This is your presentation to accompany almost all of the non-graded chapter exercise at the end of chapter 14. Chapter 14 relates to the integumentary system. One of the exercises is part of a graded assignment, so we won't be going over that one specifically in this presentation. And a few others you're asked to post to the discussion board. The first section of the non-graded chapter exercises, the coding knowledge check, is also not a part of this particular presentation. If you have a question on any of those first 5, please let me know. As you know, you can contact me via the inbox feature, or you could post directly to the course discussion area for general area for those particular 5 questions. A few of them are multiple choice, and there's 2 fill in the blank. So if we begin looking at the procedure statement coding, it's noted as procedure statement coding in your textbook. The first one is cryocautery of 5 skin lesions on the vulva. We denote that this terminology, cryosurgery, is using freezing as a way to destroy tissue. The root operation is destruction. Indexing pathway in your ICD-10 PCS coding manual was destruction, skin, and then genitalia. And genitalia relates to the vulva. You're given a 0H5AXZ in the alpha. However, we know based on our knowledge now of ICD-10 PCS that this is 6 characters, and we need 7 characters for a complete ICD-10 PCS code. So we have to go to the 0H5 table. When we do that, we verify all of our other character values, and then we get to the last character value, which is qualifier. And we find that in this particular table, as noted in the chapter, we have options. We have 2 selections or possibilities. We have D as a qualifier value or Z. And D equates to the use or denotes multiple lesions. And that applies to this particular case because this woman had 5 lesions addressed. So we choose D, and we end up with the final code of 0H5AXZD. Then moving to the next one, which is noted in your textbook as skin lesion removal, left upper back. Again, we know based on our anatomy knowledge that the skin in total is one body part. So removal of part of the skin, in this case of the patient's back, equates to excision. We're going to index the word excision, then skin, then back. We're given 6 characters in our ICD-10 PCS alpha index. They are 0HB6XZ. We know that's not a complete code. We have to move to the 0HB table. When we get there, we find the last qualifier value. We have 2 options. We have X and Z. However, this particular piece of documentation, which we're coding from, does not say anything about this being a biopsy. Therefore, we choose Z. Our final code then for skin lesion removal left upper back is 0HB6XZZ. The next one, number 3 in your textbook, is repair of a laceration of the subcutaneous tissue and fascia of the left foot with a layered closure. The root operation, based on what we have, is going to be repair. We're going to index repair, then subcutaneous tissue and fascia, then foot, and then left. We're given 0JQR in the alpha. Again, we move to the 0JQ table. We already have our body part value from the alpha, which was R. It's noted that the physician had to close this repair in layers. We also know anatomically that to get down into the subcutaneous tissue, the physician had to go through the epidermis and the dermis. So we can presume, based on this very short piece of clinical information, that this was an open surgical approach. We choose 0 for that 5th character value. Then as we move across the row, the only 2 options for device and qualifier are Z and Z. So our final code is 0JQR0ZZ. Number 4 is documented as needle drainage of left breast cyst for evaluation. That word for evaluation is important. So we know this is a drainage of a cyst. We're going to code the root operation of drainage. There's no documentation that the surgeon removed the cyst sac. So we're going to, based on what we have, we're going to code it to the root operation of drainage. We're going to index drainage breast left. We're given 0H9U in the alpha index. You move to the 0H9 table. You already have the U. It's noted that a needle was used. A needle is going to make a small puncture. Back in chapter 1, that equates to a percutaneous surgical approach. There's no documentation that there was any device, so we choose Z. And then we have this idea of documentation of evaluation. That equates to some diagnostic component. So we're going to choose X for our final character value, and we end up with code of 0H9U3ZX. And I will make the typo changes on some of these slides. So you'll see 0H9 because that's the name of the table. Just to denote that moving forward, when you see this presentation in the course, it will have those fixed. Number 5 in your textbook is documented as an evacuation of a subungual hematoma of the fingernail. If we go back to chapter 3, it talks about the fact that a hematoma is considered solid in nature. So that it then equates to this procedure being equated to the root operation of extirpation. We're going to index extirpation, then fingernail. We're given 0HCQXZZ in the alpha index, and that is a 7-character code. So my suggestion is to always go to the table just to review. The one thing you want to look at when you go to the 0HC table, or any table that you happen to be given the entire code in the alpha, you want to check the body part value. But in this case, you were given a complete code in the alpha index, and that is the correct code, 0HCQXZZ. The next one is noted in your textbook as bilateral breast augmentation with silicone implants, open approach. There's no documentation of this being a medical procedure. It's documented as augmentation. So then we are going to code it as a cosmetic procedure, and the root operation is alteration. The indexing pathway is alteration breast bilateral in your alpha index of your ICD-10 PCS coding manual. You end up at 0H0V. You move to the 0H0 table. We already know, based on our clinical information, it was open surgical approach. We choose that, which is 0. Was a device left in this patient? Yes. These silicone implants were left in her at the end of the surgery. We want to reflect that with the J for synthetic substitute on that particular area for device character value on the table. Then Z for no qualifier. And then we do have this idea in this particular case. We have one code. It covers both breast augmentations, 0H0V0JZ. The next one is a patient who has a repair of a 3rd-degree burn. The right forearm caused when he had a chemical splash on him at work. The burn measures 2 by 3, and the burn scar is excised before the skin and the subcutaneous tissue advancement flap is created. The advanced flap is 3 by 4 centimeters. So we have 2 components in this particular procedure. We have an excision of dead, burned tissue, and then we have this idea of this flap, which is denoted in your clinical information as an advancement flap. So you're going to have an excision of the dead tissue or the dead skin, and transfer would be the root operation for the flap. So if we code the excision first, we're going to use the root operation of excision. The pathway is excision, subcutaneous tissue, and fascia. It tells us that that is what is excised in your clinical information. Lower arm right is the anatomical location, you're given 0JBG in the alpha. Remember, you're coding to the deepest layer. You move to the 0JB table, you have your body part value. It says it was an excision, which is an open surgical approach, which is 0. No device, no qualifier. Your final code for the excision of the burned skin of this patient's right forearm at the subcutaneous level is 0JBG0ZZ. After they took away the dead tissue, dead skin, they then did an advancement flap. Your chapter information talks about flap coding and transfer root operation. Your pathway is transfer in your index, your alpha index, subcutaneous tissue and fascia, lower arm right. You're given 0JXG in the alpha. You move to the 0JX table. You already have your body part value, which you're going to verify. It's G. And it also was done open surgical approach. No device was left in the patient. You have a qualifier option. You have B, C, and Z. You're going to choose the skin and subcutaneous tissue, which is B. You end up with a code of 0JXG0ZB. So for this one particular operation, you have 2 codes. Number 8 is the placement of a rechargeable multiple array simulator generator into the fat layer of the patient's back, open approach. Root operations, insertion. Indexing pathways, insertion, subcutaneous tissue and fascia, back. You're given 0JH7 in the alpha. You move to the 0JH table. Again, you verify your body part. You want to make sure there's no better option based on your clinical documentation. There is not in this case, so 7 is going to be our body part value. Our clinical information tells us the surgical approach was open. The next is device. Was a device left in this patient or addressed? Yes. That's the whole point. This patient is having this device put into their body. You have several options for the device character value. When we look at them, the best choice that matches our clinical information is E, which is noted on the table as stimulator generator multiple array rechargeable. No qualifier for our last character value. We end up with a code of 0JH70EZ. Number 9 is incision of scar, contracture of the skin at the right elbow. So this patient has a scar on the skin of their elbow and it's causing them to have issues with their mobility of most likely moving their elbow or moving their arm up and down. We're going to incise it. Surgeon's going to incise it. That is going to then equate, because of what's going on physically with this patient, to the root operation of release. Also, it denotes in your textbook chapter about anatomical locations when we have skin over joints, and the joint of the elbow is considered the lower arm. So we're going to index release skin lower arm right. We're given 0HNDXZZ in the alpha. It's a complete 7-character code. 1, 2, 3, 4, 5, 6, 7. So again, my suggestion would always be to go check the 0HN table, specifically looking at this D to make sure there's no better option based on your clinical documentation. If you do that extra step, you won't have issues in terms of possibly having some problem and having a better option for this character value. In this case, there's no better option. Your code is 0HNDXZZ. The last of these short statements, number 10, is incision of a polynodal cyst. Root operation is drainage. This is just a picture to make sure you understand where this is at and what's going on here. They're going at this from the outside of the patient's body, and going directly onto the skin. We're going to index the word drainage, then skin, then buttock, because this is considered part of the anatomical region of the buttock. We're given 0H98 in the alpha. You move to the 0H9 table. Again, this is an external drainage kind of a thing. And there's no device, no qualifier. The final code is 0H98XZZ with the X equating to external because of this anatomical presentation of this disease process. Then if we move into the case studies, the first one is a patient who has had a full thickness burn on the bilateral buttocks, left thigh and right thigh. This patient is coming in for a free skin graft. Multiple anatomical locations are being worked on in this case, both of the patient's thighs and their buttocks, which anatomically is considered one piece of anatomy. This patient is having free skin grafts. Free skin grafts, again, going back to your textbook information, the discussion talks about replacement is the root operation for free skin grafts. That word free is important. So if we start looking at coding just the buttocks work, because we're going to have to code these separately because this patient had more than one anatomical area addressed. We're going to index the pathway of replacement skin buttocks. We're given 0HR8. You move to the 0HR table. You have 8 already. What was this graft made out of? It was made out of cultured epidermal material, which means this patient is donating to themselves. This tissue was harvested earlier, grown, cultured in a lab, added to, made bigger, stretched out, and now today what we're coding is the actual placement of this graft. So the device is considered autologous and the tissue substitute, which equates to 7 on that particular table. Qualifier. We are going to reflect the qualifier because, again, back in chapter 14, your textbook authors talk about this qualifier is not going to always be Z in integumentary body system. In this case, you have 2 options. You have 3 or 4 are your character value options. This patient had an epidermal graft. Epidermal is part of your skin, so that equates to partial. So we're going to choose that as our final character value, which is 4. So we end up with the code of 0HR8X74. I'm sorry, 0HR8X74 for our buttocks work. But again, this patient also had a graft put on his upper right and left leg. And we also need to code them separately. So we go back to the alpha, we're going to index replacement. We're doing the same pathway we did earlier. The only difference is going to be the anatomical region. We end up with 0HRH for the right leg and 0HRJ for the left. Again, they're placing this right on top of this patient's body, this personal skin, this child, I think it's a child, a 4-year-old child, has previously donated to themselves or harvested for themselves. And then, so that's surgical approach. Auto means self, and again, it's partial because it's epidermis. And we end up with 3 codes, one for the buttock, because anatomically is considered one organ or one body part, or body area, and then right leg and left leg. So you have 0HR8X74, 0HRHX74, 0HRJX74. So all the codes are very similar. The only difference is the body part value. The next one is a patient who has an ingrown toenail that's coming in for excision. The physician also documents he pulled it straight out. That terminology and typically how these procedures are done, and based on our ICD-10 PCS root operation definitions, that then equates to the root operation of extraction. Remember that physicians can call procedure anything they want. They call it extraction, they call it excision. We have to look as a coder at the clinical information. And when pulling something straight out, that equates to extraction. So we're going to index extraction toenail. We're given 0HDRXZZ in the alpha, and that's a complete code. Again, we want to go to the 0HD table, but that is a complete 7-character code. In addition to pulling out the nail, the physician also documents that he or she did electrocautery on the matrix component. Electrocautery is a different surgical approach, different device. We're going to use the root operation of destruction for that one. Destruction, then toenail. And then we are also, in this case, given a complete code again in the alpha. 0H5RXZZ. And again, you end up having 2 codes for this particular procedure of removing this patient's persistently ingrowing great toenail. Operative report number 3 is a patient who's coming in for a right needle localized lumpectomy of the breast. The physician documents that he did a curvilinear incision. So that equates to the surgical approach of open. This patient is having only a portion, a lump of her breast removed. So that equates to the root operation of excision. We know the location. We're going to index the word excision, then breast, then right. We're given 0HBT in the alpha. We move to the 0HB table. We already have our body part value. We already determined based on the clinical information that it was an open incision. So we're going to choose open. No device, no qualifier. The final code is 0HBT0ZZ. The next one is number 4. This patient has a pacemaker currently in their body and is coming in to have the old pacemaker generator removed and have a new pacemaker generator placed. In addition, the physician puts in a new lead. New lead is put in. The old lead was not removed. It was capped. So there's multiple things going on this particular patient. We have to code the removal of the old pacemaker generator, and we also have to code the insertion or the putting in of the new pacemaker generator. So for the removal of the current pacemaker, we're going to index the removal of device from in the alpha, subcutaneous tissue and fascia. That's where it's located at. It's always put in a subcutaneous pocket. And then trunk, because there's no chest option in that area. So you're going to use trunk as a synonym for chest. 0JPT is given to you in the alpha. You move to the 0JT table. He does talk about reopening the pocket, so you would use incision, and that equates then to open surgical approach. Was there a device in this patient? It actually should say that the device was already there. This patient's device is being removed. Was it being touched or was it left in? It wasn't being touched. The device was already there. Again, that's one typo I will fix. And that relates to P, because the device that's there, that's being removed, is a cardiac rhythm related device. Then for our last qualifier value, there's only option Z. So taking out the old pacemaker is 0JPT0PZ. Then we have the insertion of a new pacemaker. We're going to index the pathway of insertion of device in chest. 0JH6 is given. We move to the 0JH table. We have our body part value already. Our surgical approach is open because we already had cut into open. Was a device left in? Yes. It was a pacemaker single chamber. That's 4 on that particular row. No qualifier. Final code for the new pacemaker is 0JH604Z. Now in this case, chest is an option when you go to the alpha index. So you're going to choose that one if it's possible. Then we also have a lead. A new lead was also inserted. We're going to index insertion of device and then ventricle, because that's where those leads go. It states it was placed into the apex of the right ventricle. So we're going to index insertion of device, ventricle, and heart. We're given 02HK in the alpha. You move to the 02H table. We have our body part value already. The approach is percutaneous. There's no documentation in our clinical information of cutting or incising. Was a device left in? Yes, it's a cardiac lead device. That relates to J on that table. No qualifier. The code for the lead is 02HK3JZ. And you end up with 3 codes for this particular surgical event. For case number 5, 6, and 7, I have added a discussion board. I would like for you to post your answers. If you get really stuck, you do have the correct answers. Actually, you have them to all of those 3 cases, 5, 6, and 7. But you also have them in your textbook. But I would encourage you to go through the steps. Read the clinical information. Make a note of the anatomy. Circle it in your textbook. Make a note on a piece of paper if you want to do it that way. Look for your surgical approach. Go back to chapter 1. Look at your devices. Was any device already there that was being worked on, removed, addressed, fixed, or was any new device being inserted? And then if it's a skin, the first one is subcutaneous sebaceous cyst. If it's skin, integumentary, skin specifically, think about maybe when you get to the table, at least you might have to make some options for your qualifier value, not just going to be Z. So remember, your indexing is first root operation term, such as excision or resection, then your anatomy. And you're going to post your answers to the discussion board in the course. The last one, number 8, at the end of this chapter, which is a patient who has a pressure sore or a decubiti. That particular one is part of your graded exercise for lesson 13 of this course. So if you have any questions on this presentation, please let me know. Post in the lesson discussion area or inbox me here in Canvas.